Yeah. Let me, I may have done our listeners a disservice by not asking you at the outset here, where do these stem cells come from?
Oh, yeah. So that is another area that I was trying to figure out for everybody, because there are cells that you can get from a person's own body, right? You can get it from your own bone marrow, from your own fat. There are other sources too, menstrual blood, dental pulp, etc. But you can also get it from early birth tissue. It's only when the baby is born. Usually the placenta, the umbilical cord, all that, cord is cut, and that is thrown in the biological waste basket, right? You've done rotations. It's gone. It's not utilized. But now we know it's full of stem cells and powerful, powerful molecules that can signal your body to regenerate. And babies bathe in these signals. So you can get from amniotic fluid as well. So there are a lot of incredible healing elements from these sources. What I've done is that I was looking at research comparing using a person's own cells versus using the umbilical cord or placental source. And whether or not you're looking at how much growth factors they can secrete, how many generations they have left, how long their telomeres are, how wide their differentiation pathways are, how many different kinds of cells they can become. In almost every aspect, the younger cells is showing much more superior capabilities. So not only they are more potent in all these actions they can exert when they're in the human body, but they're also safer because these younger cells have somehow a better capability at recognizing cancer cells, not just recognizing them, but sending them signals to tell them to kill themselves. Whereas older cells is somehow lost a lot of that capability and is telling everything to grow. And that's why direct research have shown that if you put cancer cell, there's a glioblastoma in that research, next to fat-derived stem cells from an adult versus the same cancer cells next to umbilical cord-derived stem cells. In both cases, so these are all mesenchymal stem cells we're talking about. In both cases, the fat-derived stem cells make the cancer grow more and more. And the umbilical cord-derived stem cells make the cancer shrink and go away. That's how powerfully different they are. So I cannot, in my good conscience, utilize a source that I think can potentially exacerbate cancer. It's not going to cause new cancer to form, but we all know we have floating pathological cells, and that's just part of life. They're going to happen, but your immune system should get rid of them. But all of a sudden, if you put in cells that tells everything to grow, including cancer cells, then you are elevating your chance of getting cancer. So in a sense. So that's something to really think about. So when a person is older or have chronic illness, I think I will be doing them a huge disservice if I want to use their own cells.
Yeah. Yeah. Wow. That's super powerful. And I think that's something a lot of us don't know. So I think going back to that origin story is super important. Mm-hmm. You've mentioned a couple of conditions already in our talk today. Tell me, what are the top conditions that walk into your clinic? What do you see the most, and what do you believe stem cell therapy is most effective for?
I think the most common will be musculoskeletal repair. So a lot of joint issues, soft tissue like, bone healing but very common also is autoimmune conditions, lupus, rheumatoid arthritis, psoriasis, multiple sclerosis, scleroderma, sarcoidosis. I've seen all these patients and have good results with all of them. And neurological conditions, because these are devastating. And stem cells is one of the few things that are actually giving hope. I've treated quite a bit of autism kids with good results. And lung conditions, which is one of my favorite to treat because that's the first thing the cells go to into the lungs from IV route. Yeah. And the results are really, really good. I'm actually excited. We just helped a 9/11 responder to basically become free of lung disease after he wasn't sure how long he had to live. A lot of his colleagues, he was in the special forces, with the New York State, and a lot of his colleagues have died. These are young, healthy, right? Well-trained, very physically active this population. And he wasn't sure how long he was going to live. And of course, his lungs were in bad shape and he was severely limited. But after 2 treatments with us, he now is sprinting. And then he did a CT scan, which showed his lungs were completely clear. And it's mind-boggling. He asked his pulmonologist, of course, I've never seen anything like this. He said, can I say I'm free of lung diseases now? He said, yes, you can say that. So he is the first ever 9/11 victim, in a sense, whether or not is a civilian or a first responder, first person ever that's cured of the lung disease. So I love treating the lungs because it's so powerful. There's so few things in medicine that actually can break down scar tissue. And this is very anti-fibrotic, these mesenchymal stem cells. And how exciting is that? And then I've treated people with heart conditions, heart failure, after, people who with heart repair after myocardial infarction, heart attack, and atherosclerosis, people with hypertension, and so a lot of heart repair, and then kidneys, helping prevent people from getting on dialysis, or even helping people get off dialysis. And liver cirrhosis, I've seen just incredible, almost miraculous results with end-stage liver cirrhosis. Fertility is really cool, helping women getting pregnant, helping reproductive organ repair. Of course, for men, they want, better erectile function, and we do that as well. We can do direct injection, and I always like adding the IV, and helping with testicular, would help people who become free of testicular issues and fibrosis and infections. So very wide range of conditions. And we do a lot of anti-aging, just helping people to